Okay, so we're going to move on to this section, talk about the sexually transmitted disease first. Sexually transmitted disease, we call it STD. And if you look at the slides, this is a severe global public problems, public safety problem. 300 million cases every year in the whole world. And obviously, the sexual activity is a major transmitted pathway. There is a several things we want to mention to you is that sexually transmitted disease, 95% is to male, transmitted to the female. Whatever you can call it, it's a sexual partner will have the major risk groups. And there is no vaccine for sexually transmitted disease. So, which means, you know, get a 1 or 2 cup of shots, so you go have a happy hour. That's not going to happen in the medical area. So there is no vaccine for that. And there is no immune memorization capability of STD. So which means you have a gonorrhea, you got a 1 time of gonorrhea, doesn't mean the next year you will not have it, doesn't mean next 5 years you will have it, or the rest of your life you're safe. You may continue to have a gonorrhea. There is no immune memorization of STD. Another thing is that there is a research also show about 60 to 70% of STD, it could be asymptomatic, which means asymptom. Okay, it's very simple to tell you it's asymptom. So that's also a risk for that. Now, we always say sexually transmitted disease, it's a challenge. Is this should be a social problem or versus medical issue? That's always is a debate question. But which means, is that the social education more important, or we should develop more technique, medical technique, more drugs, more vaccines to prevent or curing sexually transmitted disease? This is always a debate. Okay. So that's some information we want to talk about that. Now, obviously, a sexually transmitted person, sexual activity people between 15 and 30 years old will be a risk group. That's obvious. So we want to talk about the first thing is gonorrhea. Okay, gonorrhea, what we want to talk about is Neisseria gonorrhea. Neisseria gonorrhea, this pathogen, is gram-negative Bacillus, same as Neisseria meningitis. This is coffee bean shape. If you look at the structure, the morphology is there, looks like coffee bean shape. Gram-negative Bacillus, coffee bean shape. We also call it gram-negative diprococcal. Okay? Because Bacillus is like a bacillus, like a coccal, but it's very short. It's also round shape. From the biochemistry standpoint, there is a very easy way you could do a diagnosis, which is oxidase test positive. And this is an oxidase reagent will turn you purple color after 1 minute reaction in the open air. You cannot do this test for too long because there is oxygen in the air. If you do oxidase test too long, then everything will become positive, give you false positive. Now, this pathogen is also a fastidious. Okay, it's a fastidious bacteria. That means if we using Macanthi agar, it will not grow. We use blood agar, it will not grow. It will only grow on chocolate agar. And very, very special, so only grow on chocolate agar. Very special. This is called modified Sayer Martin medium. It's a transport medium. Base is chocolate agar to grow Neisseria gonorrhea. Now, what is the symptoms? You look at the picture, you know that. That's a symptom. For male, there is obviously pus, white, creamian from penis. It's obviously symptoms. For female, you a little bit of difference. You will have the abnormal bleeding from on period time, and also you will see the discharge from vagina tract. Now, we want to talk about here, the basic difference is that how we do the diagnosis. The male and the female are a little bit different. For male, we get this pus, and we are going to do the gram stain. Okay, we do the gram staining technology. We also will be do oxidase test. If the gram stain, we find it is gram-negative Coccobacillus coffee bean shape, surrounded by white blood cell, and the oxidase test positive, we will say it is very possible it is Neisseria gonorrhea. Then we will be streak plating onto modified Sayer Martin median to get single colony. To confirm the colony. Okay, that's for the male. For the female, there is no way to do that. The reason is the female vagina tract has a normal bacteria, gram-positive bacteria, let's say lactobacillus, and lots of the millions of the other normal bacteria. So you cannot do the gram stain taking from the discharge of the vagina tract. So for female, the sample will be directly plated onto modified Sayer Martin medium. And you will see the colony. It is a pushable colony. So we talk about colony morphology, it is a pushable colony. So that means, tells you it is gonorrhea. And be careful about the gonorrhea. This is not only will happen for adults, for sexually transmitted patients, that also could be transferred to the newborn baby. And the newborn baby does not show any sexual activity symptoms. Not like their urinary tract, genital tract have the problem. It's very typical. They have a conjunctiveness of the newborn. They have a crust shown up in their eye. It's a conjunctiveness for the newborn. So that's a very special symptoms. So that's why I always say, if you have a conjunctiveness of the eyes, that does not mean you have a skin disease, you have an eye infection. It's very possible you have a sexually transmitted disease, more or less. So just be careful, it's a very special for that. And this is, we talk about already, there's a urethral discharge of the yellow, creamy pus, painful, burning urination. And they do have latent times, which is 7 to 21 days after infection. And the gonorrheal infection could be translocated, invasive to the joints, heart, and throat. Okay, diagnose. We already talked about the Gram-Stain oxidase test. You can do a PCR probe test to use a polymerase chain reaction. Very important for the treatments, you could use antibiotics because these are all bacteria at the end of the day. So you can use antibiotics, but remember, antibiotic resistance is dramatically happens. So penicillin resistance is very common for the gonorrhea because we're using too much. Like we mentioned earlier, it's a social problem or it's a medical tech problem. Public education, condom use, quick diagnostic and immediately time for treatment, it is also important. Okay. Next transmitted disease we want to mention is a syphilis. Syphilis. We want to say this syphilis is a very special disease caused by a special bacteria called spiral sheet. The typical name for the spiral sheet is Treponema pallidum. And we mentioned about the spiral sheet in our exam 1. This is kind of like asexual filament. It comes through the body through cuts, bites, abrasions, and there is very soft. So you cannot using a special dye to do it or do the Gram-Stain. You need to rely on a very special, not really special, a different microscope, which is called dark field microscope. Okay, so that's something we want to talk about. Just give you a little bit like introduction. Okay, syphilis, there is a general syphilis caused by Treponema pallidum. Obviously sexually transmitted, but remember the newborn baby could have the syphilis, which is called congenital syphilis, acquired into the urethra. Syphilis has 3 stages. The first stage is called chancre. This is coming from a French word. What means chancre? in the penis, there is an ulcer comes out. They are called shantering. This is the first stage. This stage, 1 to 3 weeks. Some people say 2 to 5 weeks, around that period of time. Okay. Second stage, guma. What happened? If people has guma, the whole body, you will see those red dots, including arms. That's called a guma. What happened? What's so confusing for people? It's very interesting. When you develop to the guma, the second stage, this is gone. Because it's called a sexually transmitted disease, so people will be majorly taken care of and they pay much attention to the lower body. They do not care about the others. Once you see there's an ulcer there and then it's gone, you think you're recovered. Then you can continue to have a sexual activity. Unfortunately, you're going to transfer for the other people severely. And by the way, syphilis has been there for maybe more than 300 or 400 years. That is a major first discovery of sexually transmitted disease in the history. Okay? The second stage is the guma. The third stage, this guma could be 5 weeks to several months. The third stage, it could be go to progressive, and they will have neurological symptoms. That could be more than 20 years. Another thing what happens is that once you have a guma, you have a relatively relieved symptoms. And then you didn't go this stage. And you are a carrier rest of life. Even you are showing kind of symptoms. That's another risk. Because the scientific research has been showing sexually transmitted disease for the people, for the patients, it's not the lower body problem. It's mainly is neurological, the head, the brain system. Okay, some people have a sexual addictiveness or something other weird symptoms that's related to the brain. So that's why the syphilis, those 3 stages, is kind of very confusing. Lets people feeling about it's recovered, it's relieved. However, the pathogen is always there. Okay, so that is for the syphilis. Syphilis, there is not much best way to do. You're going to see the clinical history, the microscope exam, serological typing you could do, and basically using dark field microscope to see the treponemia pallidum, because it's a very typical symptoms. And we said about you can do antibiotic therapy in the early stage. And you could do a prompt treatment of mucus, sexual hygiene, use of condom is more important for the follow-up. Okay? So these are the 2 things we want to mention. The last one related to the disease is Lyme disease. That's not a sexually transmitted disease. But we want to talk about this because lots of the people have this disease If they like to do diving, like to do aquatic activities, this one usually will happen. So Lyme disease. So what is the Lyme disease called? This is from Connecticut, a county called Lyme County. And this happened in 1970s. What are the typical symptoms? We have a picture for that. Is in the arm area, you have these target-like rash. Or we say it's a bull-eye rash. And eventually, it will develop to neurological symptoms. At the beginning, you may have a fever, flu-like symptoms, but eventually you may have neurological issue. Now, what is a major person who finds this? What is a pathogen find this? This is also a spiral sheet. And the spiral sheet is called Borrelia burgdorferi. Burgdorferi. I want to make sure that Burgdorferi. This is a name. Dr. Burgdorferi is a professor, microbiologist from Montana State University. He is the first person back in 1970s find this disease. Find the symptoms is a spiral sheet. The genome name is Borrelia, and the species name tried to memorize, gave the credits for this great scientist. And the Montana State University have a very good microbiology program. Especially they do tons of the research for the biofilms. I do see there is a advertisement for the summer internship is surrounded in the email list, which is the Montana State University have a summer internship for the microbiology research. So if you're interested, you can look for that. Just want to give you some other things. So Borrelia burgdorferi named by a great scientist. Okay, so since it's spiral sheet, we mentioned you using dark field microscope could do the diagnosis. It is very interesting. The Lyme disease is have a multiple stages. And you can see the picture here. At the beginning, it's a larvae. Then the larvae goes to find the mice. Then the mice will be developed the larvae there and become what? Goes out. The egg comes out in the spring. In the summer, they're going to find the mice. The mice is the middle host, intermediate host. And then the larvae will be dominant from the in the leaves or in the environmental samples going through the fecal sample of the mice, and they're going to find a person. At this stage, will become a nymph. And then the nymph will find another mice, and finally, the final host is actually a deer. And there is a multiple steps here. Okay, there is a nymph. There is a mice. There is a deer. So it's a multi-state host transmitted spiral sheets. How are we going to do the control? You're certainly not going to kill deer, is that right? You're not going to put a gun to kill all the deer in this forest and say they're going to control Lyme disease. That sounds ridiculous. Is there any way to control mice? Obviously difficult. Millions of mice, more mice than human beings in the world. How are you going to do it? So what's we going to be focused? Is we're going to control this thing, ticks. Very interesting. The ticks you have to control. What type of the ticks? Isodex ticks. You have to well control the ticks is the key for the Lyme disease control. Now where this comes from? Aquatic area. So if you do ocean fishing, the deep ocean fishing, the diving, and the marine, any of the aquatic activity, then usually you need to do annual exam inspection to see whether you have a screening test for the Lyme disease. It's very quick. You're using ELISA methods, Western blot to serological typing, and you could do a PCR polymerase chain reaction test to see the Borrelia DNA. If you see there is symptoms at early stage, you have to use antibiotics immediately. Otherwise, it's going to develop very possible go to neurological symptoms. So what's the key here is tick control and isodex ticks control. So that's very interesting for the Lyme disease. Okay, so that's we finished right here briefly. Okay, next one. Since we already finished talk about the major disease in the United States, what are going to be the treatment? And we mentioned lots of times the treatment is using antibiotics. So we're going to spending some time talk about antibiotics. We're going to finish half of that, not all of them. Not all of them. Okay. So next lecture we want to talk about is antibiotics. So that will be our next topic, antibiotics. This slide is just to give you an introduction. Chemotherapeutic agent, synthetic chemicals administered to people, animal for treatment disease. Then we have antibiotics, we have antimicrobials, means naturally chemical synthesized. So we want to focus here to talk about antibiotics. What is that? And we know penicillin, for example. You know about that. You know tetracycline. Couple of names. So what is that? Antibiotics. It is a metabolic ingredient. Ingredients from one microorganism used for curing or inhibiting another microorganism. That is the definition for antibiotics. And most of the time, this one microorganism is yeast or molds. Or molds. Even pathogenic molds. Let's say penicillin. And another microorganism, most of the time, which means bacteria. For example, penicillin, coming from penicillin, used to curing bacteria. And we all know that if we say it is cure bacteria, that means it's cidal. And if it's inhibit bacteria, which means it's static. And we talk about using microbiology growth curve microorganism growth curve, you could show that. Okay, what happened? Lag phase, log phase, stationary phase, and death phase. What means static inhibit? The inhibition time will be longer later on like this. That's called static. What means sidle? Which means they go down. That's called sidle, curing. That means sidle. Okay, so that's something we already mentioned. We want to say that majority of the antibiotics fit this definition. However, in the history, there is an exception, which is sulfur laminate, which is we call sulfur drug, just as simple as a sulfur drug. This is chemical synthesis. However, we still call it is antibiotics. But obviously, right now, you know there is amoxicillin, methicillin, later on comes out, it's all chemical synthesis. That's what we call it a chemical modification. Originally, it's still coming from penicillin. However, sulfur drug is at the beginning is chemical synthesis. But we still say it is antibiotics. Okay, just want to give you something hands-on. Next one. This is a cell history. We talk about the antibiotic therapy. So 1912, Paul Ehrlich is the first person who discovered the salvarsan, which is a treatment of syphilis, chemotherapy. Okay, we call it a chemotherapy by the time. It's different from chemotherapy today. Today you heard about the terminology is horrible because it's used to treatment the cancer. Is that right? That's different. By the time, they use chemotherapy to talk about antibiotics, which means by the time, syphilis is a severe disease, it causes cancer. So very interesting. The first time people are using antibiotics is treatment of syphilis. Who is the first real antibiotic generator, which is penicillin by Fleming in 1929? Burgee and Wixman discovered streptomycin. Streptomycin, the first time in 1944, is against tuberculosis. This is a milestone in the history of the microbiology chemotherapy. You can say about that. Before 1944 comes out, tuberculosis is equal lung cancer. You had tuberculosis, you almost die. And how many of those piano musicians in the European country, back in 1970s, 1980s, because of the lung disease, they died. Most of them are tuberculosis because there's no good treatment. Even using traditional herbs, like in China, there's a lot of traditional Chinese herbs. You cannot control that disease. Because we mentioned the waxy cell wall, the long chain unsaturated fatty acids, the mycolic acids, the dye cannot go inside, the lots of the drugs cannot go inside. The only thing to crack down the cell wall system is using antibiotics. So 1944 is a breakthrough in the modern history. The first broad spectrum antibiotics, which means they can kill both gram-positive and gram-negative bacteria, is chromomycetin. This guy does not using anymore. It's used dramatically back in 1950s. However, the side effects is too severe because they will be dramatically decrease bone marrow cells, which means your immune system is dramatically damaged. So the side impact is very long. It's very huge. Nobody uses it anymore, only life-threatening situation. 1950s to now, antibiotics used widely for treating human disease, and however, it generates a problem, which is antibiotic resistance, because we're using way too much. And I said very honestly, antibiotics is more effective for gram-positive bacteria than gram-negative bacteria. Even today, because gram-positive bacteria has a heavy peptidoglycan, and the gram-negative bacteria does not have that one. That's the reason why E. coli 0157H7 salmonella is a problem. Otherwise, you have those foodborne disease, you just take 2 pills of penicillin, you're safe. No, not really. Because antibiotics more likely work efficiently for gram-positive bacteria. Next week, Tuesday, I will show you the structure. You will know why this looks like that. This is a picture which is showing the penicillin grow on the blood, on the agar, to killing bacteria. You see the transparent zone surrounding the penicillin. And these are big smear, which is bacteria. That's a fungi, as they generate the transparent zone. Okay, several index we wanted to introduce to you. Selectivity, toxicity. We already talk about that, kill or inhibit bacteria, which means cyto or synthetic. Therapeutic dose, drug level acquired for clinical treatments. Toxic dose, which means the level will become too toxic to do. Therapeutic index, this index is therapeutic dose divided toxic dose. This number should be the smaller the better. We want this be smaller the better. We want this be higher the better. Is that right? We don't want you using gram of a dose. We don't want you using a microgram, milligram. We want you using microgram, possibly. Toxic dose, we want them the higher the better. So imagine if you're using 1 gram of penicillin, you're still safe. That's good. So that's the index looks like. Therapeutic dose. Okay? Toxic dose, sorry. No, sorry. Objective. Sorry, toxic dose, therapeutic. Okay, then that should be the larger the better. This should go down, we go up. Is that right? The larger the better. Sorry. The larger the better. We want this dose to be the minimum. We hope this reach microgram. We hope this reach gram. So the larger the better. Okay. Side effects, undesirable drugs on the host cell. Well, side effects there's a lot. Especially when we mentioned about some of the antibiotics going to be affects the protein area, the protein synthesis, then they have a more severe effects compared to the antibiotics who working on the target is the cell wall. So what are the side effects? Hearing loss. That's more using tetracycline too much, you have a hearing loss. Yellow teeth. Lots of people have that. You have a fluorocol using. If you will have a dramatically white blood cell decrease or even bone marrow cell decrease, which means the immune system could be damaged. So those are the side effects. Another one, obviously, if you're using antibiotics too much, what are we going to see? the first reflection. Diarrhea, because normal bacteria, lactic acid bacteria and other beneficial bacteria in the intestinal has been cured by those drugs. The normal intestinal area has been damaged. You obviously will followed by the diarrhea. So diarrhea usually is the first symptoms. Sometimes you have a diarrhea accompanied with a lower level of fever. That's the side effects. Okay, narrow spectrum drugs, which means they only affect gram-positive or gram-negative. So that's called narrow spectrum, which means only gram-positive or gram-negative bacteria. In other words, there is another terminology called black spectrum, broad spectrum. There will be both for gram-positive and gram-negative bacteria. The last two terminology we already mentioned. Cyto agent, curing bacteria. Static agent inhibits growth of microbes. Okay, that's we already mentioned. Next we want to mention is that how we measure the antibiotics. Okay, we want to mention to you several examples. The first one is called Kirby blood test. This is a semi-quantitative test. So how to do that? I have an agar. This agar is not a traditional agar, not like a neutral agar, tropic soil blast agar. This agar is molar Hilton agar. Molar Hilton agar. What we call it MH agar. It's a very special, only for antibiotic resistant. So the first thing what we do, you're going to grow a bacteria on the agar plates. Let's okay, I get a single colony. So I put a single colony into 0.9% saline solution. So we added it, and then we mix it. Now, how much bacteria we added? There is a standard. You can't say, okay, we scrub bacteria as many as possible. No, the standard called 0.5 McFarland standard. This is used to compare a standard silicone tube to see the turbidity. If they reach 0.5 McFarland standards, which means they are 10 to the 8 cells per ml. Then we're using a cotton swab to cover the surface. So we do this, perpendicular, and then to do horizontal. Usually we do twice. Okay, we are assuming the bacteria is already there on the surface. What we do next? We're using this Kirby blood dispenser. Okay, there is a dispenser looks like this. Dispenser. Dispenser usually can hold a couple of discs, So you press the button, the disc will be stacked on the surface, like that. Every disc will have two labels. For example, they have PE and TAM. What's the PE means? Penicillin. What's TAM means? 10 microgram per gram. It's a concentration. So once you put it there, then this place storage 35 degrees Celsius for 24 hours. What are you going to see? You will see somehow, somewhere, there is a transparent zone surrounding this circle. More or less, you have some. Then, you're going to use a ruler to measure the diameter. So we're going to measure the diameter. Okay, then the next question is, more or less you're going to have the diameter because the inhibitory zone. Then how do you know the antibiotics is effective for this bacteria? You need to look at the standard table. Also, let's take that. You need to look at the standard table. Okay, let's give an example. Here I get 12 millimeter. Here I get 16 millimeter. This I get 32 millimeter. Okay, I get a certain number. So I'm going to look at the table. The table you usually see I, O, and S. Okay, what is R means? Resistant. What is S means? Susceptible. What is I means? Intermediate. Okay, very important. We always talk about a bacteria, how they reacted to antibiotics. We do not call them sensitive. For example, E. coli 057H7, ATCC 100 is very sensitive to penicillin. We don't say that. We say it is very susceptible to penicillin. Why? Remember, antibiotics cannot randomly to give shots for the patient. You need to do what? Skin allergy test. Lots of people are penicillin allergic. You cannot do it. So, if a human being is allergic to antibiotics, we call sensitive. For a bacteria, we call susceptible. Okay, so now let's look at the table. Let's say the table. This is 15. This is 18. This is 22. And I got a number which is 12, 16, and 32. Let's say 3 different samples. Then what this means? This obviously means this pathogen is resistant to antibiotics. So which means this antibiotics, you cannot use it. How about that? Intermediate, better don't use it. The last one you find is more than 22. That's susceptible. Is that right? So that's what you should pick. But are you sure this is the dose you should use? No, we have to do a special test. That's why there is another two tests accompanied with it. This is another semi-test called E-test. What means the E-test is means you use a strip. A strip is already containing the twofold decreased dilution of the antibiotics. And on the other surfaces, there's the bacteria growing there. And you put the strip there. You need to read the number is at the intersection. The intersection number is MIC. Minimal inhibitory concentration. This is an extremely important number. We want it. And the MIC is specific for one pathogen and for one patient. So if let's say, penicillin 10 ppm, or we say 10 microgram works very well for corral, does not mean that concentration works better for me. Maybe I need 20 ppm. Maybe I need 20 microgram. This is all has to do an individual test for the patient. This comes out with a more quantitative test is using tubes. So this is what happens in the hospital. All the time they do. Right now they are multi-tube screening tests. You can do in a couple of seconds. All the time what they do, they compare in twofold serial dilution of these tubes. Each they containing bacterial solution, antibiotics, and they add a bacteria there. And they use them to do the incubation. And after incubation, what they need to see? Obviously, you will see the control is bacterial growth. A very low dose of the antibiotics, there's a bacterial growth, which means they turn to turbidity. Then you suddenly will see there is a number which is no bacterial growth, no turbidity, and it is transparent. And the lowest number showing transparent is the number what you need, is called MIC. So for example, the organism A, the MIC, you find the first tube which is transparent is 0.12 microgram. The organism B, you find it's needed 1 microgram. That's not good, that's already very high. Okay, usually you need to be at least like 0.25-ish. Organism C, it's very resistant to antibiotics. You need 16 micrograms, that's very high. And don't forget, you need a control, which means the sterilized solution, there's no bacterial growth. Because if the sterilized solution have a bacterial growth, what this means? Which means your testing tube is already contaminated. So make sure that sterilized solution is good enough to do the test. So this is a 3 different levels to determine the effective concentration of antibiotics to curing a bacteria. In our AEM 341, which is a major lab, we did the COVID blood test, but here we don't do it. So I just introduced that to you, okay? Okay, before we end of the class, we wanted to just briefly mention, detail will come in next week, Thursday. Antibacterial mechanism basically could be concluded as inhibition of cell wall synthesis, inhibition of protein synthesis, nucleic acid synthesis, metabolic pathway, and cell membrane integrity. A very simple question for you. Which one is the safest one for human being to use? Obviously, it's on the top. Not because it is on the top. The reason is bacteria has cell wall. human and animal does not have cell wall, which means it's safe to use, relatively. So, when we choose antibiotics, the number one you choose, the target is cell wall. If antibiotic resistance happens, you have to pick the one which is below. Usually we pick the second one, inhibit the protein synthesis. But unfortunately, I want to tell you, if the antibiotics is targeted for the protein synthesis, they will have side effects for the human being. Because human being has protein synthesis process also. Okay? And if you inhibit for nucleic acid synthesis, basically means nothing. Because nuclear synthesis have a lot of mutation will be generated. So always keep in mind, science very advanced. Everybody like molecular. However, if you inhibit the nucleic acid synthesis, which means the mutation going to generate, we don't like it. Metabolic pathway, cell membrane integrity, which means you're not killing bacteria. You only inhibit. And inhibition cell membrane integrity, you cannot be oral take. You can only do skin surfaces. So, ornament, you can buy like a toothpaste, buy one sample from CVS. That's for the skin rash, for eastern mold control. That's for inhibit the cell membrane integrity. Inhibition of metallic pathway, sulfur drug. Okay, so sulfur drug is not that effective compared to penicillin. This we will talk next week Thursday. There's a lot of we can talk about these slides. Okay, so that's all we have today.